Just as it is important to pay attention to what we put in our bodies, it is equally important to get our heart pumping blood more effectively through exercise. When we pay attention to our diet, we are trying to make our life easier for our hearts, and when we exercise, we are trying to increase the ability of our hearts to do work. Just like we lift weights to make our biceps stronger, when our hearts are out of shape, we need to exercise our heart to make it stronger and more able to pump blood around our body, therefore making it easier to get nutrients around the body and live our daily lives. When we exercise, we are also improving the way that our body makes use of those nutrients. As the body becomes more conditioned through exercise, it distributes nutrients more efficiently. As a result, the heart doesn't have to work as hard as it did before. How does exercise translate to noticeable results? There are a few key indicators. One such way exercise improves our hearts is by reducing blood pressure. Remember that by consistently increasing cardiovascular exercise, our heart becomes better at pumping blood. As the heart continues to improve with exercise, blood pressure continues to decrease. The reason that high blood pressure is bad in the first place is because it makes our arteries less elastic and weakens our hearts. In the name of making our hearts strong and happy, we need to ensure we exercise often to avoid conditions such as high blood pressure. There are many options out there of different types of exercise to pursue. To name a few, strength training, flexibility training, and cardiovascular training. While all of these forms of exercise can be extremely beneficial in their own ways, cardiovascular training most directly impacts the health of our hearts, which is what we are primarily worried about. And even when we focus on cardiovascular exercise, there is still a wide range of options. We might start with something as simple as walking, or may be interested in more intense forms of exercise such as running, biking, or swimming. All are great options to keep your heart in great shape. As a general idea of how we should structure our training, it is important to begin with a short warm-up, approximately 5 minutes. Warming up primes the body for exercise to avoid harmful injuries. Following the warm-up, we can get into the exercise itself, which should usually last around 20 to 30 minutes. The proper duration of exercise will vary slightly from person to person, so it is important to pay attention to how your own body reacts. A bit of discomfort is normal, but be cautious if you feel you are putting your health in danger by doing too much. Make sure you're listening to your body. For example, if you feel short of breath, weak, dizzy, or lightheaded while exercising, make sure to slow down or rest until the symptoms go away. If you feel a fast or irregular heartbeat, be sure to take a breather and check your pulse again after 15 minutes. If it is higher than about 120 to 150 beats per minute, then contact your doctor. If you experience any intense pain or pressure in the chest, arm, back, jaw, or shoulder, be sure to call 911. For someone who is less accustomed to endurance-based cardiovascular training, or if you want to take it easy to start, you can begin with full walking-based cardiovascular training. One possible starting point for your walking program can consist of 20 to 30-minute walks over a period of 5 days per week. To get acclimated to each walk, start with a 5 to 10 minute slow, steady warm-up walk. This is a great way to tell your heart and the rest of your body that it's time to start exercising. After you've started walking for the first couple of minutes, gradually begin to increase intensity. At this point, our body has prepared itself to start exercising, and now we really want to make sure our heart gets pumping and tested. A point of caution, however, while we want to push ourselves and get ourselves heart healthy, when first starting your cardiovascular exercises, it's important to keep your personal limits in mind so that you don't harm yourself and offset the benefits of the exercise. For example, if you find yourself unable to talk while walking, that's a good sign that we need to pump the brakes and take a break. When we're exercising, it's good to remember some key tips along the way. We want to ensure we've allowed time to pass since our last meal. Exercising on a full stomach can be detrimental to the workout itself, so in order to let our food digest, wait about 90 minutes after eating before exercising. Similarly, always remember that hydration is key. When we exercise, we sweat, and when we sweat, we lose water. In order to replenish the water lost during exercise, we need to ensure that we stay hydrated. Finally, we really want to be mindful of our bodies, so it's important that we rest both after our exercise and, as needed, while exercising. Given that we want to maximize the effect of our workouts on our bodies and our hearts, we should work on gradually increasing our intensity level, which will slowly decrease the need to rest during a workout. Start slow, listen to your body, and then slowly turn up the intensity. The benefits of exercise go far beyond heart health. Exercising can help our overall well-being. It is known to reduce stress, tension, anxiety, and depression. As we continue to exercise, we can become a happier and healthier person altogether. It is important to remember that a little goes a long way with exercise, and being consistent can take the results to the next level. Just like with our diets, there are many exercise options out there, so remember to find what works for you and your lifestyle, whether that might be something such as swimming, biking, running, dancing, or any sport you can think of. At the end of the day, if you find something you enjoy, it will be much easier to stick with it and yield noticeable results for you and your heart.